So I just want to start by thanking my friend Miranda for being my volunteer for this assignment. And we're going to begin with our skin assessment. So can I see your hand? And I'm just assessing her skin, looking at the color, feeling the warmth. Her skin is warm and dry. Her capillary fill is less than 3 seconds. Skin turgor is elastic. There are some nevi present, but they seem to be normal for her skin tone. And so now moving on to her head. Her head is normocephalic and atraumatic. There doesn't seem to be any bumps or lumps anywhere. Just looking at her hair is evenly distributed. It is a regular texture. There doesn't seem to be any hidden lesions anywhere that I'm looking at. There's no signs of infestation. And I'm just going to palpate. Do you have any tenderness anywhere?
No.
Okay. Going down to her eyebrows. Her eyebrows are even in a full distribution all the way to the lateral edges. Her eyelashes are also full and evenly distributed. There's no sign of infestation. Her eyelids are free of edema. There doesn't seem to be any redness or drainage from her eyes. Any pain?
No.
So no pain at her lacrimal edge. Any pain up here?
No.
No pain in the frontal sinus. Any pain down here?
No.
No pain in her maxillary sinus. The anterior and inferior aspect of her nose are clear of erythema. There doesn't seem to be any drainage coming from her nose. Her lips are moist and pink. There doesn't seem to be any cracking or any lesions. So we're going to go and do her eye exam. Her conjunctiva and her sclera are white. There is no sign of injection. And so now I'm going to darken the room so I can do my fundoscope exam. Just going to turn the light on. It's set to 0 diopters. And going in at a 15-degree angle, I'm just going to locate the red reflex, move in towards her eye centrally. I'm locating the retinal vessels and then moving centrally until I find the optic disc. Okay, her disc is clearly demarcated. There are no signs of any cotton wool bodies. There's no hemorrhages that I'm seeing. With my legs from my ophthalmoscope, I'm going to just assess her pupils. They're round and equal bilaterally. I would also do the fundoscope exam on the other side in a real setting. Okay, so I'm just going to shine a light and check for constriction. Consensually, and just of the pupil itself, consensual constriction is present in both. Going to turn the lights on, lights off. And I'm going to test the extraocular muscles of her eye. I'm just going to have you look, just follow the top of my ophthalmoscope. We're going to go in an H pattern to get the 6 cardinal fields of vision. And then we're also going to do the mirror test while we're here to check her convergence in her eyes. Her pupils do constrict as they focus on the ophthalmoscope getting closer to the bridge of her nose. Okay, so going down to her nose, we already inspected the anterior and inferior portions of her nose. So popping on the otoscope tip, just going to turn the lights on, and I'm checking just superficially. Her septum does not appear deviated. It is midline. And then very gently, without touching her septum, I'm just going to go into the vestibule of her nose and looking at the inside of her nair. Her nair is patent. The mucosa is pink. There is no drainage or anything present. And then I would do that bilaterally as well. We already looked at her lips when we were assessing her face. There's no cracking and no dryness. So I'm just going to go ahead and have you smile. Her teeth are equal. There's no teeth missing. There's no sign of any tooth decay. I'm going to have you open your mouth. I'm just looking at her buccal mucosa. Everything is pink and moist. There is an appropriate amount of saliva. There's no lesions that I'm seeing on her hard palate or just visually in the back of her soft palate. I'm going to have you stick out your tongue and say ah. one more time. Perfect. Her posterior pharynx and her tonsils both raised symmetrically. I mean, her posterior pharynx and her uvula raised symmetrically. There's no exudate or anything or erythema on her tonsils. I'm just gonna have like, can you raise the tongue to the roof of your mouth? I'm looking for any erythroplakia or leukoplakia or any other lesion that might be hiding under there. I'm just gonna have you move your tongue to one side. Perfect. And then the other side. Perfect. I'm not seeing any lesions or sores anywhere. All right. Next, we're gonna do ears. Okay. So on the outside of her ear, there is no edema or erythema. I'm gonna do a quick tug test. Is there any pain here when I pull on your auricle? No. Any pain here on your tragus?
No.
Any pain here on your mouth?
No.
No? Okay. I don't see any external drainage. To do an otoscope exam, I'm just going to pull her auricle out, back and away from her head, resting the otoscope on her skull. I'm just going to take a peek till I see her tympanic membrane. Her membrane is pearly white. I see the bony landmarks of the incus and the handle of the malleolus. The cone of light is at 5 o'clock, which is the regular position in the right ear. I would then do the same on the left ear. I'm going to do a whisper test by standing 2 feet behind her. I'm going to be testing the right ear for this, so I'm just going to have you plug your left ear and massage the tragus to make sure any sound is excluded from that ear. I'm going to take a deep breath and exhale before I do my whispers. And I'm also going to be, just so you know, I'm doing a combination of 3 letters and 3 numbers, and I just want you to repeat what I say. Okay. RL2. Perfect. And then I'm just going to do one more round.
B1S.
Perfect. Okay. So her auditory function is intact, and I'm also going to do a field of vision check because I forgot to do that while you're testing eyes. So I'm just going to have you point to which finger is wiggling, and I'm going to be testing your peripheral fields of vision. Okay, her fields of vision are intact for the purposes of this exam. All right, so we did all the way up to ears. So now we're going to go down to nose. We already did nose. We're going to do neck. Just looking your trachea is midline. There doesn't seem to be any obvious enlargement anywhere. I'm going to have you swallow. Okay, everything moved as one when she swallowed. I'm just going to palpate posteriorly as well. I'm going to have you do your swallow reflex. Great. I could feel the thyroid move as she swallowed, just palpating the isthmus of it now, and I'm going to deviate it to each side to make sure I'm not feeling any enlargement or any nodes that I can't feel anything. Okay. So for your lymph node exam, I'm going to do pre-auricular. And to feel lymph nodes, I'm just using the pads of my fingers and moving in a circular direction, post-auricular. Feeling for any, this is tonsillar, submandibular, submental, any enlarged nodes which I'm not feeling. This is her anterior cervical chain, her deep cervical chain, and her posterior cervical chain. And then the supraclavicular cervical area, there is no lymph nodes that I can palpate, no masses. All right, I'm gonna have you lie down. The bed is at a 30-degree angle.
I'm gonna take up your time. He's trying to get my
Okay, so she's lying at a 30-degree angle. I'm gonna start by auscultating her carotid arteries. And to do that, I'm gonna have you look a certain either direction, left or right. I'm gonna auscultate with my diaphragm of my stethoscope, and I'm just gonna have you hold your breath for a second. Okay, you can take a breath. And I'm gonna have you look in the opposite direction and hold your breath again. Perfect. So I'm not hearing any bruise, so I'm gonna go ahead and palpate both carotid arteries. I'm gonna have you look in one of the directions. Perfect. I'm gonna have you look in the other direction. palpable 2 plus. And before we move on, I'm going to look at her JVD presentation. So I'm just finding the topmost area of pulsation on her neck, which is right here. And then I'm going to hold that card horizontally and then put a ruler right on her sternum and line those two up. And her angle is at like 1.5 to 2 centimeters, which is a normal finding. And I'm going to inspect her pericardium, look for any abnormalities, any deviations. There doesn't seem to be, so I'm going to go ahead and palpate. Any tenderness? No. Okay. And I'm looking at the 5 pulse areas of her heart. So on the right sternal border at the second intercostal space, there is the aortic space. I'm just palpating here for any vibration, feeling for any heaves or thrills. And at the pulmonic space, which is at the left sternal border at the second intercostal space, we're just palpating here. Third intercostal space on the left sternal border is Erb's point. Fourth intercostal space on the left sternal border is the tricuspid space. And then at the midclavicular line at the fifth intercostal space is the aortic area, or the PMI. We're just in the mitral space as well. Just palpating, feeling for any heaves, any vibration. And I didn't feel anything, so I'm going to go ahead and auscultate with my diaphragm. So at the second intercostal space on the right side, our aortic area, just listening for S1 and S2. All right, S1 and S2 were heard at all locations. I'm just switching to my bell to assess for any murmurs that may be present or any rubs. No murmurs detected. To accentuate anything that might be there, I'm going to have her lay on her left lateral side. And I'm again just going to find that apical area, the aortic space, feeling for any new vibration, any new heave. And I'm going to use the bell of my stethoscope to listen to that area. All right, I don't hear any mitral regurgitation or anything, so I'm going to have you sit up. And then using the diaphragm of my stethoscope, I'm going to assess for an aortic murmur. And to do that, I'm going to have you lean forward just a little bit. I'm going to have you inhale, exhale, and I'm going to move down from the second intraclavicular space down to her PMI and listen for any murmurs, which I did not hear. That would be an aortic murmur. Okay, so now we're going to move on to the lung assessment. I already palpated the anterior portion of her chest. There was no tenderness upon palpation, so I'm going to start with tactile firmness exam. So I'm going to have you repeat 99 until I tell you stop. All right, go ahead.
99, 99, 99, 99.
Okay. Tactile firmness was heard bilaterally and symmetrically, which is the normal finding. I'm going to percuss all the lung areas. All sounds are resonant, and now I'm going to auscultate with my diaphragm and having Miranda take a deep breath, listening to the whole breath at every spot. adventitious sounds that I heard. I'm gonna repeat the process on the posterior side. So we're gonna do tactile fremitus. So we'll just repeat 99 until I tell you to stop. Stop.
99, 99, 99, 99.
Okay. Tactile fremitus was heard bilaterally and symmetrically, which again is a normal finding. I'm now going to test for her lung expansion. So I'm gonna have you take a deep breath. My hands are at around T10 and I did watch them move symmetrically. I'm gonna percuss down to assess the resonance of her lung fields. Thank you. Okay, all lobes are resonant. I'm now going to have you take a deep breath, exhale, and I'm going to find upper part of your diaphragm. So that's where I found dullness. I'm going to stop there. I'm going to have you take a nice deep breath, and I'm going to palpate down, percuss down until I find the lower margin of her diaphragm excursion. You can release that breath. And I have her right at 4.5 centimeters, which is the normal finding for diaphragmatic excursion. And to finish her respiratory exam, I'm just going to auscultate her, the lobe fields in her back. So deep breath. Okay, all lung fields are clear. And again, there's no adventitious sounds, even at her lower lungs, of any crackles, wheezes, or rhonchi present. All right, and then to wrap up, I'm going to do just look at her peripheral vascular system. So we started looking at her skin at the beginning of her hands. Her cap refill was good on her hands. So I'm just going to look at her radial pulses, palpate those. They are symmetric and easily palpable 2+ reading. Next, I would normally do her femoral arteries. I'm going to skip them for the purpose of this assignment. I'm going to do her popliteal pulse. Again, it's a 2+ pulse. Looking at her pedal pulses, they're felt symmetrically and evenly, and I would still rate them at a 2+. And her posterior tibials, again, bilateral, and rating at a 2+. I would also do her other popliteal pulse normally. Just looking at her legs, her skin is even in color. There's no areas of coolness. There's no edema that I'm seeing, no areas of discoloration. Her cap refill is still less than 3 seconds. Her skin turgor is normal. There are no signs of arterial insufficiency. There's no hair loss, no nothing. All right, and that concludes our exam.